I'm going to do my very best to be on time, not only because that's my last name, but because it's the end of the day, and I can appreciate wanting to be done on time at the end of the day. So thank you for having me. I'm going to start by telling you that our wonderful grad student, Jennifer Parrott, has done the analysis of this data, so I'm going to do my best to do her justice. And if I don't, please don't tell her that I didn't. We, just like everyone else, not so long ago, realized that veterinarians were at increased risk of suicide and other negative mental health outcomes. So we sought to get some Canada-wide data in the spirit of understanding ourselves better, with the hope of then doing better going forward. So in our study, we benefited very much from the work that was done in the UK and chose to try to get even a little bit more data. So we looked at perceived stress, burnout, depression, anxiety. Does anyone have an interest in me digressing into compassion fatigue versus secondary traumatic stress versus all of, because it says secondary traumatic stress on the slide, which is part of compassion fatigue. I'm going to mush them back together. Compassion, satisfaction, resilience, and suicidal ideation. And we were curious about whether veterinarians were experiencing similar levels of those things to the general population or not. We've also done a bunch of other really cool things with this data. This was the first thing that we did. So this is, I'm going to describe our population. It's coming out in JAVMA sometime soon. Takes a long time to get things published in JAVMA. You seem to have done very well, Dr. Ned, at getting your things in a timely fashion. Maybe they struggle with their neighbors to the north. Anyway, so we have two official languages in Canada, French and English. So we had all of the scales in both. Some of the scales, I believe, probably did not have an official French version, so maybe not as validated when it was done in French, but many of them did. Our inclusion criteria were that you had to be a veterinarian in Canada. You did not have to be actively practicing, which we'll see a little bit in a minute. We used social media and local veterinary associations. In Canada, we have 10 provinces and 3 territories. In some of the provinces, we have associations that are sort of advocacy associations that are separate from our regulatory bodies, and some they are together. So the survey recruitment notice did not go out through any list associated with a regulatory body. I found it very interesting this morning that obviously RCVS is your regulatory body and they're working really hard. We avoided ours for the reasons stated, that we were afraid people wouldn't want to do a survey associated with mental health in their regulatory body because people seem to be very concerned about any big brother moment or admitting weakness to their regulatory bodies. So we sent it out through every other avenue that we could think of. And there were a lot of them. Breed, species-specific bodies, geographical areas. I know more about small-town Canada and small geographical Canada than I ever did before. We looked at 10 scales or subscales. We used the Maslach Burnout Inventory, which has 3 subscales: emotional exhaustion, depersonalization, and personal accomplishment. The Professional Quality of Life Scale has secondary traumatic stress, burnout, and compassion satisfaction. And then we used the Perceived Stress Scale. We used a suicidal ideation scale, and we used the same scale that you used in the UK. We used the Hospital Anxiety and Depression Scale. So in looking at our results, we unsurprisingly have an abundance of females that completed our survey, just about 3/4. The distinctly colorful pie chart is province of residence. That is representative of population, generally speaking, so we had adequate representation from all of the provinces. Looking at the species of our patients, again, that is representative to what we would expect of who's in companion animal practice versus food animal or mixed. And on the far right, we see what the role was, whether people were in clinical practice, non-clinical, or not currently working. An interesting note about not currently working is we have a year's worth of parental leave in Canada, so with all of the females in the profession, this is completely speculative, but I would imagine that some of the people that did the survey may have just been on leave for that year. In looking at sort of what types of people did our survey, about people who had been out just under 20 years since graduation, mean age of about 45, and worked just under 40 hours a week. We had about 500 clinic owners, just over 600 associates, and the remainder were locums, interns, or faculty members. Non-clinical, I think we probably had some interesting non-clinical, probably academia, maybe those that weren't in a teaching hospital. So that's what our participants looked like. In terms of what our results for those mental health outcomes looked like, unsurprisingly, it wasn't great. So on virtually every index, it was higher than the normative population, except for perceived stress, personal accomplishment, and compassion satisfaction. So it's just not great. I'm going to let that speak for itself. But looking specifically at what wasn't so great, most specifically, secondary traumatic stress was very high. Not only was it high compared to the normative population, it was significantly higher than the other caregiving professionals where we could look at what their published data was. As in the last slide, and I think all of the studies that were reported, females fared less well than males did. Our suicidal ideation proportion is very high. But I really think that it's important to recognize that sort of across the board, whether it's emotional exhaustion, depersonalization, the burnout, within the professional quality of life score, there's a separate burnout index that was high. So our results are overall very concerning in terms of the points that someone may hit before they get to an end point of suicidal ideation or death by suicide. They are higher than the results seen in the UK for anxiety and depression. And our resilience score, so more resilience would be better. The US general population's resilience score is 81. The score for veterinarians in our survey was 68. In the survey manual, 68 compares to psychiatric inpatients. I personally find that upsetting as a formerly practicing veterinarian. All studies have limitations. Ours includes a non-response bias. We were just discussing sort of open sampling versus targeted sampling. So we know that about 10% of the veterinary population responded to our survey. My lovely grad student has told me in my notes that non-response bias in mental health research can actually lead to an underestimation of prevalence because those who are having a hard time may be less willing to participate, but that's conflicting in other studies. We have looked at late responders as a proxy for non-responders and not noticed a difference in those groups, so we are hopeful that our estimates are close to reality given the limitations. Obviously, the population of veterinarians that responded is very skewed towards females, but we also did gender-specific analysis, and females fared worse there, so that sort of helps give strength to that analysis. We're also, and I think until we are able to follow more veterinarians forward and look at who stays in clinical practice and who doesn't, we do have the risk of the healthy worker effect where those people that are in practice longer have gained resilient skills, are doing better, and we lose those people who were struggling earlier on. So from our study, it's going to click to the next slide in just a second. There we go. And I'm going to tell you that we have a high prevalence of poor mental health outcomes in Canadian veterinarians, certainly compared to the general population. And there is a significance between genders, with females veterinarians faring worse than males. We have some thank yous to the people that gave us the money to do this. So we are thanking Zoetis for a gift. Our our charitable fund at the Ontario Vet College Pet Trust. Thank you very much to our graduate student, Jennifer Parrott, her committee members, Andrea Jones-Bitten, Jason Coe, Amy Greer, and Deep Kosa, and really to all the veterinarians that have gotten on board. I've been really proud of our veterinary community about how we're rallying around this, and I don't think veterinarians are known for their survey doing skills, but I think we've really stepped up when we see a mental health survey, so I'm very grateful.
Thank you.